This evening, first up, a sanctioned oil tanker flying Guyana's flag, but our shipping authority says it has never heard of this vessel. Tonight, how fraudsters tried to use Guyana as a cover for an illegal oil run and why they failed. Then, if you are waiting on a house lot and someone contacts you with a shortcut, stop. Scammers are now posing as government housing officials, and thousands of Guyanese families are in their crosshairs. Plus, 1 year ago today, 11-year-old Adriana Younge was found dead in a hotel pool. Her family is walking in her memory this evening and still demanding answers that have not come. Meanwhile, artificial intelligence is coming to your doctor's office. The health minister lays out an ambitious plan to transform healthcare in Guyana, from diagnosis to treatment, using cutting-edge technology. And ceasefire talks in the Middle East are on shaky grounds, and President Trump is ramping up pressure. We have the latest on where negotiations stand and what it means for the region. Those stories and more coming up. Stay with us. Welcome to this broadcast of Channel 2's Headline News Update for April 24th, 2026. I'm Baby Bacchus. Thank you for joining us. First up, Guyana's Maritime Administration Department, MARID, has moved swiftly to distance the country from a seized oil tanker, clarifying that the vessel does not appear in Guyana's ship registry and that any claim to the contrary is false and fraudulent. The agency confirmed it was informed of the seizure of the tanker Majestic X by U.S. authorities in the Indian Ocean, where it was reportedly intercepted while transporting Iranian oil. The vessel had previously been sanctioned by the U.S. Treasury in 2024 under the name Phoenix. In a statement issued on Thursday, MARID said there is no records of the Majestic X in Guyana's National Registry and its purported Guyanese registration is fabricated. The agency noted that while the ship's name may have changed, its IMO number in international database remains linked to the sanctioned vessel Phoenix. MARID reminded the public that Guyana operates a closed ship registry, meaning only vessels owned by Guyanese nationals, CARICOM citizens, or countries incorporated under Guyanese law are eligible for registration. The alleged owners of the Majestic X do not meet any of those requirements. The department further noted that fraudulent vessel registration have been an ongoing challenge since 2021, with bad actors targeting multiple countries, including Guyana and Panama. MARID said it continues to share intelligence on such cases with international partners, including United Nations maritime bodies. As global scrutiny of sanctioned vessels intensifies, Guyana is sending a clear message. Its flag will not be used as a shield for illegal maritime activity. In other news, while thousands of Guyanese families wait anxiously for their chance at a piece of land to call their own, unscrupulous fraudsters are cashing in on that desperation. The Ministry of Housing and the Central Housing and Planning Authority are sounding the alarm over a surge in scams targeting Guyanese citizens seeking residential house lots, young professional houses, and commercial land allocations. In an urgent public notice, CHNPA made it clear that it is not offering any discounts, special promotions, or preferential access to any group or applicants, and that anyone claiming otherwise is engaging in fraud. Authorities specifically flagged a TikTok account falsely claiming affiliation with the ministry, warning citizens that it has no connection to the agency whatsoever. The Central Housing and Planning Authority is reminding the public that all legitimate financial transactions must be conducted in person at its main office at 41 Brickdam and United Nations Place, Georgetown, or at regional housing offices where an official receipt is issued for every payment. No fees are required to fast-track an application or update personal information, and the ministry does not initiate contact via WhatsApp regarding house lots allocations. Citizens are urged to rely exclusively on official government channels and to verify any housing-related communications through the official Ministry of Housing or CHNPA social media pages. Your dream of a home should never become a scammer's payday. Verify everything, trust only official channels, and report suspicious activities without delay. Moving on, the family and supporters of 11-year-old Adriana Younge are marking the first anniversary of her tragic and mysterious death with a memorial walk and service, even as unanswered questions continue to haunt the case. Adriana's body was discovered in a pool at the Doubleday Hotel on April 24, 2025, nearly 20 hours after she was reported missing during a family outing. Her death, later ruled a drowning, sparked national concern due to the unusual circumstances surrounding the discovery. Speaking ahead of today's observance, her mother, Adriana Younge, said the family is choosing to honor Adriana's memory through positive action despite ongoing grief. The memorial walk is set to begin at Perica and end at the hotel where her body was found, followed by a service with close relatives, friends, and supporters. The case remains under scrutiny, with the Department of Public Prosecutions recently ordering an inquest to determine the full circumstances surrounding the child's death. The inquiry will seek to establish key facts, including the cause and conditions of her passing. Despite the complete police file and prior involvement of international investigators, including a retired Canadian officer, concerns persist over the pace and transparency of the investigation. The Guyana Police Force has since maintained that the matter remains active. Young Adriana Younge would have been 12 years old this year. Instead, her family walks in her memory and in pursuit of the answers that, 1 year on, remains heartbreakingly out of reach. Stick around when we return. AI to transform Guyana's healthcare system. Minister of Health outlines vision. And walk-in health testing coming soon as Ghana pushes AI-driven care.
Good girl forget things.
What's the problem, Granny?
I want money for borrow for doing surgery. I was dancing and I fall and fracture my hip.
If you need some quick money, you should check Lender's Jewelry and Pawn Shop.
Lender's Jewelry and Pawn Shop, Lot 238 South Road Border, Georgetown. Get jewelry made to order in just 72 hours. We also accept vehicles. Lender's, best rates, longest payback period.
Boys, I get through. Plus, I could dance again.
Lender's Jewelry and Pawn Shop.
Welcome back. Ghana is moving decisively towards a modern, data-driven healthcare system with plans to integrate artificial intelligence into medical practice and public health delivery, according to Minister of Health, Dr. Frank Anthony. Speaking at an AI seminar at the Ghana Marriott Hotel in Georgetown, Dr. Anthony said the country is shifting from reactive care to a more predictive, precise, and evidence-based approach. He noted that AI is not just improving healthcare systems, but fundamentally transforming how medicine is practiced, enabling better diagnosis, treatment, and patient outcomes.
Diagnosis has always been a cornerstone of medicine, but it has been constrained by human limitations, such as time, experience, and cognitive bandwidth. But AI is changing all of that. Today, machine learning systems can analyze radiological images, detect tumors, identify fractures, and diagnose conditions with high degree of accuracy, sometimes matching or even surpassing human specialists.
The health minister highlighted ongoing collaboration with the Mount Sinai Health System as key to advancing this transformation, alongside new data protection legislation to safeguard patient confidentiality. He also reported progress in the rollout of electronic health records at the Festival City Polyclinic and the Georgetown Public Hospital, aimed at improving efficiency and continuity of care. Additionally, efforts are underway to train local professionals to support and expand digital health infrastructure.
We also recognize as we implement these systems, you are going to have challenges maybe with clinicians, the thing might freeze or something might happen. And we thought that it's important to have a tech workforce. And so one of the other areas that we've been working on with Mount Sinai has been how do we develop our own tech workforce? And we have a number of students that are currently in training, and once they complete training, they are going to be paid for the next 3 years, and they are going to do this job. So we are looking at this in a very holistic way, not just one part, and then we have gaps in the others. We want to make sure that this is quite holistic.
Dr. Anthony highlighted the use of data to strengthen public health initiatives, including the National School Health Screening Program, which has already reached thousands of children and is helping guide targeted interventions. This seminar, held under the theme Turning Promise into Practice, Integrating AI into Healthcare, brought together local and international experts to explore how AI can be effectively leveraged to enhance healthcare delivery across Guyana. Staying with current events, Guyanese will soon be able to walk into community-based centers to conduct basic health tests, marking a major step towards a more accessible, tech-driven healthcare system. President Dr. Mohamed Irfan Ali made the announcement on Wednesday during a national seminar on artificial intelligence in healthcare at the Ghana Marriott Hotel in Georgetown. He revealed that the self-testing centers will be established in familiar community spaces such as hospitals, churches, mosques, and temples, making routine health screening more convenient for citizens.
Primary health care is essential to make AI successful. Public health is critical for AI to be successful. Now, why? Because primary health care gives us what we call the elementary data for tracking and evaluation. So we have, for example, are going to set up these testing centers, the self-testing centers across different communities, where you can go in and test your sugar levels, your pressure. You're going to involve the hospitals, the churches and the mosques and temples in this. So on Sunday, someone go to church, they come out, they test their sugar levels, they test their pressure, they then input it into the system collects the data, and we can evaluate how that person is doing, whether they're taking their tablets and so on. So that is an important part of what we're doing.
The initiative will allow test results to be fed directly into a national health information system, enabling continuous monitoring of individuals' health over time. President Ali said this grassroots approach is critical to supporting AI in healthcare, as primary care data will drive tracking and evaluation. The move forms part of a wider strategy to integrate Ghana's health data into a single national platform. The president also noted that AI is already being used in radiology services at 5 hospitals, with plans to incorporate the country's electronic identification system into healthcare delivery. The initiative signals Ghana's continued push to modernize its health sector through innovation and data-driven solutions. Don't go away after the break. Philippines supply crisis, remote communities looking for alternatives, and Russia port city attack. Fire at oil facilities on Black Sea impacts residents.
Good girl forget things.
What's the problem, Granny?
I want money for borrow for those surgery. I was dancing and I fall and fracture my hip.
If you need some quick money, you should check Lender's Jewelry and Pawn Shop.
Lender's Jewelry and Pawn Shop, Lot 238 South Road Border, Georgetown. Get jewelry made to order in just 72 hours. We also accept vehicles. Lenders, best rates, longest payback period.
Boys, I get through. Plus, I could dance again.
Lender's Jewelry and Pawn Shop.
Welcome back. Now we take a look at what's happening in the region and around the world.
Good evening, I'm Dominic Gittins. Tonight, the Bahamas marks a major health milestone, eliminating mother-to-child HIV transmission. Middle East ceasefire talks hang in the balance amid rising tensions. The Philippines grapples with economic strain, and a Ukrainian drone strike sparks a massive refinery fire and pollution crisis. We will begin in the Bahamas. The World Health Organization and Pan American Health Organization have certified the Bahamas for eliminating mother-to-child transmission of HIV, marking a major public health milestone. Officials credit strong healthcare systems, early testing, and universal antenatal care. The achievement placed the country among the selected global group and highlights regional progress in HIV prevention, with leaders urging continued efforts to eliminate communicable diseases across the Caribbean. Trump pushes diplomatic pressure in the Middle East as ceasefire talks involving Israel, Lebanon, and Hezbollah face uncertainty, while tensions with Iran continue over nuclear and maritime restrictions. Al Jazeera's Alan Fisher reports.
A push from the Oval Office, a meeting due to be held at State, moved almost at last minute to the White House to use the power of the President. Israel and Lebanon's ambassadors agreeing a 3-week extension to the ceasefire about to run out.
And we think that the President of Lebanon and the Prime Minister of Israel over the next couple of weeks will be coming here. They've agreed to an additional 3 weeks of, no firing, ceasefire, no more firing. Let's see. We hope that happens. It's not going to happen between them, but they do have Hezbollah to think about.
At an earlier event, it was the other war in the Middle East that provoked most of the questions. No deadline to the ceasefire, says President Trump. No panic to get a deal. Several days ago, Donald Trump posted on his social media platform that the Iranians had agreed to a number of things. No more enriching uranium, no nuclear bomb ever, no reparations to the United States. President Trump hasn't made it clear who he was speaking to or if those assurances still hold. The patient approach is a change for Trump. On April 7th, he threatened to end an entire civilization. Many in Europe and across the world worried what that meant. Asked in the Oval Office if he considered using nuclear weapons, he brutally dismissed the idea.
Why would I use a nuclear weapon when we've totally, in a very conventional way, decimated them without it? No, I wouldn't use it. A nuclear weapon should never be allowed to be used by anybody.
The US insists the ongoing blockade is a huge success.
This blockade of Iranian ports will be enforced and applies to all vessels regardless of flag.
Squeezing Iran financially, pushing them to a deal. It has even moved another aircraft carrier into the area. While Israel and Lebanon are sitting down with the hope of a deal, there's little public sign of fresh talks with the Iranians. Trump says he's patient, but has warned the Iranians time is not on their side. Alan Fisher, Al Jazeera, at the White House.
The government of the Philippines declared a state of national emergency last month as it confronts the economic impact of rising global prices. But far from the center, many remote communities are finding their own ways to cope with these challenges. Al Jazeera's Jamila Alendugan reports.
Families from outlying islands in this part of the Philippines used to come to the town of Bongao to stock up on provisions.
I now buy just one fish and share it with all my children, even if I don't get to eat much myself. My wrist is swollen, but I can't even go to the doctor. I used to come to Bongao more often, but now, unless I have enough money.
Like many people here, she's taking her goods back to the town of Simunul. It is 2 hours away, but City says she has saved up for this trip. Southern Tawi-Tawi province is rarely part of the national conversation, largely because it's far from the major islands. But people here are feeling the impact of rising fuel prices. Passengers say fares have increased sharply. Authorities have declared a state of emergency. This is what global economic shocks look like at the margins. Households cut back on food and travel becomes less frequent. Even the most basic necessities are now treated as luxuries. Most goods once came from Zamboanga City, a day's boat ride away. But a ferry accident last year disrupted travel. As formal supply chains falter, communities are forced to turn elsewhere, often to older, more resilient networks, including across the border to the state of Sabah in eastern Malaysia. Goods imported from Sabah are now cheaper than those from within the Philippines. Many say they help stabilize prices. For some, Sabah has never felt like another country, but an extension of familiar ground across the water. In the local Sama language, Simunul translates to a place of refuge, shaped by history and, like its people, sustained by endurance no matter what unfolds in distant places. Jamela Alindogan, Al Jazeera, Simunul, Tawi-Tawi, Southern Philippines.
A Ukrainian drone strike ignited a blaze at the Topsail oil refinery, an adjoining seaport that has burned for 4 days, causing severe pollution in the city. Al Jazeera's Yulia Shapovalova reports.
The fire at the Topsail refinery and seaport, sparked by a Ukrainian drone attack on the city last Monday, has been burning for 4 days. The situation in the city has become an environmental disaster.
Ukraine's target was the Topsail oil refinery, which forms a single production complex with the marine terminal. Following the attacks, an oil spill appeared in the waters near the port, though it's no longer visible, and authorities say they're monitoring the situation.
In several districts, air pollution level is still twice the norm. The dangerous substances end up on the skin of people and animals and in their lungs. They also pollute fields, fruit orchards and farms. But the situation is worse in the areas closest to the port. Toxic particles were released into the atmosphere and fell on the ground in the form of the oil rain, contaminating everything it touched.
Combustion products which fell in the city with the black rain have created a black film on all the surfaces and made clothes dirty too. These ones I was wearing just for 20 minutes yesterday.
After remaining silent for several days, officials have issued recommendations for locals, telling them to keep windows shut, spend less time outdoors and wear face masks. But residents expressed concern, saying authorities could have done more.
Of course it's harmful. Toxins are released and it all stays in the lungs.
No one's being held accountable. No decision has been made. They could have suspended work for us. They could have announced that we should take kids out of the city, but they're just poisoning us and pretending nothing's happening.
Svetlana says her home is very close to the refinery.
We were absolutely terrified of the attacks. When the drones were flying over and air defense systems were shooting them down, there was no place to hide. After the attacks, we couldn't see daylight for some time. Now we can't open windows and have to dry laundry in the apartment. I don't allow our daughter to leave home.
Authorities promise the situation will return to normal as soon as the fire is extinguished, but ecologists are less optimistic. They warn about long-term negative consequences triggered by toxic emissions into the air and water, which will affect everyone and everything here. Yulia Shapovalova, Al Jazeera, Topsail, Russia.
Thanks, Dominique. This brings us to the end of our regional and global news coverage. Up next is the 3-day forecast. And that's Safety with 2 Headline News for this Friday evening. As we take our leave, we invite you to follow us on Facebook and YouTube. We will be off for the weekend, but you can tune in on Monday at 7 p.m. for more news. Until then, please take care of yourselves and each other and do have a wonderful weekend.